Hello and welcome to another Members Minute. This is Michelle Hamburger and I am here with Dr. Connors.
Hello, hello.
Today's Members Minute we are going to be speaking about protomorphogens, how they are beneficial to patients with cancer. So I will just let you take it away.
So protomorphogens were developed and are patented by Dr. Royal Lee, who started the company Standard Process. And they're still only sold by Standard Process. And what are they? So protomorphogens are parts of a organ tissue cells of organ tissue, part of the nucleus of organ tissue cells. And typically they were used in practice as a supplement to help stimulate the patient's body. So if you take protomorphogens, you're stimulating the organ of which the protomorphogen you're taking. I'll show you the different ones that are out there. Now there's a lot of information with cancer right now about peptide therapy with cancer to help stimulate the organ of the cancer. So let's say if I have liver cancer and I take specific peptides of liver, which a peptide, remember if you watch any of our other videos, a peptide is a portion of a protein. So that can be specific to whatever protein that that peptide comes from. So peptides that can be specific to the liver can stimulate your body to affect the liver, whether it's stimulating an immune response to the liver. So if I have liver cancer and I use a liver peptide, it can stimulate an immune response to the liver, which would be good if I have cancer in the liver. But it's still under such investigation in trying to develop these peptides because they're trying to develop them as pharmaceuticals. And that takes years and years to get that through qualifications through FDA. Well, Standard Process has been making protomorphogens, which are very similar in nature and do very similar things. They've been making these for decades. And we began using these to help cancer patients deal with specific cancer. So to take liver protomorphogens with liver cancer may help. It's just in theory stage at this point, but it may help the body's immune system spark against that cancer in the liver. And it may help target, if a person is doing other therapies like other immunotherapies, could target the liver more directly. Or even chemotherapy, could it target the liver directly? That's exactly how the current studies with the pharmaceutical creation of peptides are based upon. They're going to be used with chemotherapies, and can it help the chemotherapy target that cancer site? So in understanding the definition, a protomorphogen is extracted from the nucleic acids within a tissue organ cell. That's coming from the nucleus of the cell. So you asked about vegans and taking this.
Oh yes, so since these protomorphogen supplements are derived from organ tissue of animals, if one of our patients was put on a diet that was meant to stay away from meat or dairy, would there be any contraindication to taking protomorphogens because of the peptides coming from an animal?
Absolutely not. So if a person is on a diet to stay away from meat because the amino acids, glutamine and serine and methionine, in some cases, some people with cancer, those amino acids can be fuels for the cancer. So then we put them on a more vegan type diet. We put them on a dairy-free diet because of IGF-1 levels and growth issues and stimulating mTOR. Protomorphogens do not do that. So protomorphogens are not going to violate that. Now, they are made from animal tissue. So if you're on a vegan diet for religious purposes or spiritual purposes or something, then you may think twice about taking a protomorphogen because it is derived from very clean sourced animal organ products. Now, there's not protomorphogens for everything, so that is the downside. Here are the current protomorphogens that are used. Biast has to do with bone, but then you can derive what organ this is from by just reading it. But all the supplements that say PMG after it, that means protomorphogens. So there's some blends like Simplex F and Simplex M, that stands for male and female, that have a blend of different protomorphogens and possibly some other helpers for female organ issues and male organ issues in that product. But these are the different protomorphogens that are out there. So the theory is by taking a protomorphogen along with whatever cancer killer you're using, whether it's a chemotherapy or whether it's medicinal mushrooms, will it help that medicinal mushrooms or chemotherapy target that organ better? That's the belief system. So that's the studies that are going out. I just find it fascinating that they're spending millions and millions of dollars of studies on similar things that brilliant people like Royal Lee discovered and had theories about 60, 70 years ago, and that functional doctors have been using for years to help their patients. So now we're trying to, with all this information coming about with peptides and cancer therapies, it just sparked our interest to like, wow, we could use protomorphogens the same way. Would it work the same way? I don't know. That's what we're trying to do. So we're excited about this, adding this. They're fairly inexpensive thing to add to a patient's protocol. Take them with the current cancer therapy, whether it's nutraceuticals or pharmaceuticals, could help those things target the cancer better. So
interesting. So if somebody had, let's just say somebody had prostate cancer and it had metastasized into the bones, would they have any benefit from taking Biast?
Yeah,
or would the benefit primarily be coming from the primary tumor?
Well, I'd say both, because you're using the protomorphogen for prostate, because if I have prostate cancer metastasized to the bone, that still is prostate cells, right? Mm-hmm. However, we want it to go to the bone too, so I could see a benefit of doing both.
So for patients of ours that have either just cancer in one particular organ or region or metastasized to multiple organs, they could use one or a myriad of different protomorphogens during their therapy.
Yeah. This is all still in theory, but it's making sense. It's obviously making sense to the pharmaceutical companies because they're pursuing it heavily right now, and it's already been done somewhat. So it's good information.
Wonderful. Thank you very much.
All right. Bye-bye.